Welcome to the latest episode of our podcast, Open Mind. And Craig and I are absolutely delighted. We've got Willem Kuyken, Professor of Mindfulness and Psychological Science at the University of Oxford. So delighted to have you with us today, Willem. Welcome.
It's a privilege to be here, Rory and Craig. Thank you for inviting me.
Welcome in.
What we're delighted about is obviously what really fascinates me about the work that you do is you've that balance in which you've got the highest quality of science, but you're also obviously bringing it into practice in everyday life. And what we're hoping to do in the podcast is obviously take our listener and viewer through a bit of a journey in your life, Willem, and which is really starting with what got you interested in mental health and a bit about your background, but also really focus in on your book, which for those who are watching on YouTube, which came out last year, Mindfulness for Life. But obviously what's at the heart of the book is a lot of the great science that you've done, and we'll talk a bit about that. And then really, because it's a research podcast, I'm really keen to also think about what do you see as the key issues and burning issues, in particular in mental health research and also in mindfulness research moving forward. So that's a sort of hopefully our broad track over the next, whatever, 30 to 40 minutes. So let me just maybe, with that sort of intro, let's go back to the beginning. So where did you your interest in mental health start? Where did you? I know you obviously trained in the UK, but you obviously haven't got a British name. So tell us a bit about that history of you.
Rory, there's lots of different versions of that one, which I think might be most interesting to your listeners, which is I was incredibly lucky to spend 2 years in Philadelphia working with Tim Beck, who is many people would say kind of the grandfather of cognitive behavioral approaches. And I learned something from him, which I think is incredibly profound at the heart of mental health research and at the heart of the profession we're both part of, clinical psychology, which is he said to me in our last cup of tea before he sent me on my way, he said, whatever you do, Willem, never become an armchair psychologist. And what he meant by that is what I'd observed over those 2 years is he was just fascinated by what people told him about their struggles with mental health and the way in which depression shows up, the way in which anxiety shows up, the way in which addiction shows up. I was working with him on a suicide trial, and he just really wanted to understand from people themselves what their lived experience was and then what worked.
Mm-hmm.
So what I'm getting at there is, yes, he was a theoretician. Yes, he was an incredibly clever scientist, but he was always working with his clients, with his patients. And then the third part of that, which Rory, I think you're pointing to, is I'm going to use a word, mensch. He was a mensch.
Mm-hmm.
What I mean by that, he was just an amazing human being. He had such real compassion, such real care for his patients. And it wasn't like he'd come in for his 50 minutes and go on their way. He really had a sense of wanting to engage with people. It was a deeply personal project, his work. And that's true for me too. So I think there's something about mental health work being very much about not being an armchair psychologist. Yes, having theory. Yes, doing the very best science we can, but really listening to what people are saying and then really looking at what works and what doesn't work and never losing our own humanity. This is an us, not an us and them.
Yeah.
Those are the things I learned from that experience.
Okay, so but that was that postdoctoral. So what was that? Where did you do before that? Let's go a bit back into your interest in sort of mental health or psychology. Where did that come from, and where did you train?
So like I said, there's so many stories I could tell. I was sitting in a cafe at the age of 15 with a friend of mine with a broken heart, and he said, "You know what? You should be a psychologist. You're good at this." Less flippant answer is, I've always been really interested in psychology, and I do think there's something about what we really need in the world at the moment is to use the very best psychological science to address not only our personal issues, but some of the issues we're facing in a society as a whole. I think psychology has so much to offer the world, and I've always thought that, and I thought that as a young man. And I also struggled as a young man with depression and, finding my own way. And so I found it really helpful personally, a whole range of different things I found personally helpful. And I think it gives you a kind of sense of purpose to the work, right? If you know that this isn't just something that you do that's
Mhm.
abstract out there. And I think
Yeah.
that's partly why I told the Tim Beck story, because I think that was true for him too. Not that he suffered from mental health problems as such, but it was a deeply personal project, I think.
And then so then you did psychology undergraduate first, right?
Yep.
Did you go into psychology with the aspiration to go down the clinical route or?
No, I'm a great believer in, you just take every junction in the road as you go along.
Mhm.
So yes, I did undergraduate psychology, and then I was lucky enough to have an offer of a funded PhD studentship after that, which I did at King's College London. And then I again was in the lift, in the elevator at the Institute of Psychiatry, and there was a job advertised at the World Health Organization. And I applied. And the head of department at the time, I think it was Jeffrey Gray, knew the person at the World Health Organization and wrote me a reference. And then I spent 2 years traveling around the world for the World Health Organization on a project looking at quality of life.
Wow.
That
Yeah,
was
I saw that in your
fascinating.
CV. I couldn't. Okay,
It
right.
was, Rory, it was amazing because I,
Yeah.
would- I would go into like hospitals in Delhi and Madras and in Hunan province in China and in Beijing and in Africa and all around the world. And of course, mental health, it kind of has these cultural variations, but the essential issues are the same. And then the way people were dealing with them in these different cultures was very, very, very different. And there was an incredibly inspiring head of the division at the World Health Organization. I don't know if you've
Yeah, yeah, yeah. Mhm. Mhm.
how much change we can potentially make and how much difference we can potentially make. And I thought, gosh, that was an extraordinarily inspiring 2 years. And I learned so much, I learned so much. So just to give you an example, at that time, you'll remember the literature on expressed emotion was coming out.
Yeah.
The way in which sort of families for people with psychosis were really prevalent. And I remember being in hospitals in Madras where people had been brought into hospital for very serious either physical health or mental health problems. And what I found was extraordinary was their families stayed with them for the duration of their inpatient stay. They brought them to the hospital. And actually, in some places in Madras, they slept around the bed.
Wow.
And that meant that if the catheter bag needed emptying, there was always a family member to do that. And there was a little kerosene stove. You imagine health and safety. A
Exactly.
little kerosene stove. And if you're getting the food that you like and that you're used to, it's going to help you with your recovery. If you're surrounded, we know this from the literature now. If you're surrounded by people that you know and that you feel comfortable with, that's going to enhance your recovery following a physical
Mhm.
health or a
Yeah.
mental health kind
Mhm.
of intervention. And I just had this sense of there's so much we can learn from different parts of the world about how things are done. So that was a really deeply inspiring 2 years.
And then so then you did those 2 years and back to the UK then?
Yeah, back to the UK via, I was working, I think it was in Thailand or in China. And I picked up in the airport this book, which was about Buddhism. And in those days, this was pre 9/11. I always made a point of asking if I could sit up with the pilots. And I spent most of that flight back from Bangkok sitting up with the pilots in the jump seat, reading this book about Buddhism and talking to them about, because from the front of the plane, you can see the whole starscape and
Yeah.
the skyscape. And I was reading this book going, my God, like 90% of this is the same as what I learned in my undergraduate degree. And I'm finding this personally really resonant and actually potentially helpful, right? Here are practices to support focus. Here are practices to cultivate
Yeah. Yeah.
compassion. Here are practices to change perspective. I thought, that's not dissimilar to what Beck was doing with CBT. And so for me, that was also where the sort of seeds of really a deep interest in Buddhist psychology and the Dharma were born as well. Plus, it was kind of cool. I wish we could all still sit up with the pilots. I mean, it's pretty
Well,
cool up there, right?
well, I have a number of questions on that. So literally, you would ask when you get on a plane, just a regular plane, and say, "Can I?"
This wasn't a regular plane. This was one of those 747s, right?
Okay, a plane, but like a passenger plane, right?
Yeah, I mean, did you never do that? I did it all
No,
the
never in
time.
my life.
I would say one flight out of two, and I was flying a lot at that time. I would sit up with the pilots, and if I was, sometimes they just say 10 minutes, sit down, have a quick chat. But on this occasion, I just got on so well with the pilots, they let me sit
Yeah.
most of the
Yeah.
flight up there with them.
Wow.
And we just got on really well because I love sailing, and there's a lot of parallels between sailing and flying. And so we were just talking, and yeah.
Well, I know what I'll try next. My next flight.
You're
So
not allowed to do this anymore, Rory. I think there's been a few occasions which means that it's really quite hard to get into the pilot's cockpit
yeah.
these days.
But getting back to serious business, and so that's really interesting. So I was my one of my questions in advance of this was trying to see how you went from the sort of CBT type approach to obviously embracing the Buddhist approach, and of course, I know mindfulness-based cognitive therapy brings together both. So,
Yep.
but so you had independently then the Buddhism interest in Buddhism had that came independently of the work you did with Tim Beck and others.
Yeah, I mean, I have to say, I think there's a lot of overlaps. But when I was traveling in places like Thailand, I just was really interested in the way in which some of these Buddhist ideas were woven into the fabric of society in ways which seemed to be helpful to mental health.
Mm-hmm.
So I'll give a small example, which I think is maybe quite prescient with how much people talk about ADHD and so on these days. I remember sitting on a bus with a mother who had a baby and a toddler. And I think it was a 7 hour bus ride. And the baby and the toddler were incredibly contented. And, they would have been bored, right? The toddler in particular would have been bored. But there was no reactivity to that boredom.
Mm-hmm.
Somehow that toddler had internalized some skills, and the mother was providing, I'm going to say the word container, for that toddler to be able to be okay with a 7 hour bus journey without the need for, well, there were no iPads, but the
Mm-hmm.
need for an iPad or tantrums or whatever. And I thought that's really interesting. What's happening here?
Mm-hmm.
And I think that's where some seeds were born. And I think people are I think we quite like to say that's this school of psychology and that school of psychology. Tim Beck wouldn't mind me saying that, after lunch, he had this big armchair in his office. He would do some meditation and have a nap.
Mm-hmm.
I mean, nowadays we understand how important sleep is.
Yeah.
And there are very few people who would say that the evidence base for mindfulness practice and well-being isn't quite well established. Tim Beck was doing that before anyone was even thinking about it. He just knew after lunch that some time in that armchair
Yeah.
for a
Yeah.
bit of meditation and a nap was good for his mental health and presumably his productivity as well. So I'm not a big fan of trying to say there's this camp of psychology over here
Yeah.
and this camp
Yeah.
of psychology over there. I think the project of trying to understand mental health, promote mental health, enable human flourishing is much bigger than camps.
Okay. Yeah. No, I think that's wise words indeed. And I think we have spent, I think psychology, I think sometimes more than other disciplines, I think we've been guilty of really siloizing. And I think well, my own view is I think that reflects our insecurity often as a discipline.
Yep.
And whereas we should be just going, what's the best tools? What's the best theoretical perspective to address the question? And I think we are doing that more and more as we're now whatever into our
Yep.
second century as a discipline.
Yes.
And okay, so I want to do two things. Now, one is I want to move on to the book, but I also want to then talk a bit about the evidence
Mhm.
underpinning mindfulness. So I don't mind which would you rather do first? Do we talk about the book first because it's
No,
got less
let's do the evidence.
Okay, let's do the evidence first then. Okay, so I know about the mindfulness-based literature from the depression and like the suicide work and stuff that Mark Williams did
Yep.
and others, and then you've been obviously heavily involved, obviously with led the Myriad trial,
Yep.
which will tell the listeners what that is in a second. But let's go before the Myriad trial. And where do you see the state of the evidence
Okay.
in adults?
So the state of the evidence for mindfulness-based cognitive therapy, which is a sort of 8 week program that teaches people skills to help them recover from depression and stay well, I would say is one of the great success stories
Yeah.
in psychology. And I think, CBT is one great success story, and I think this is another. So it's gone around the whole, what we sometimes call the translational pathway. What that means is having a clear theoretical idea, turning that into a treatment, asking if it's effective, and then asking if we can implement it.
Mm-hmm.
That's a sort of slightly geeky way of putting it, but what that means is can we develop an intervention that we've got a really clear idea about why it might work? Can we then be really definitive and ask, does it work? And then can we get it into practice? So in mindfulness-based cognitive therapy for depression, what I mean by a success story is there have been probably now 15 randomized controlled trials demonstrating two to three things very clearly. The first is that when people go through this mindfulness-based cognitive therapy training program, they stay well and recover long term at rates significantly and unambiguously better than if they just had usual care. The
And
second thing that's really,
but just to come into that just for a second there,
yep,
so what's for again for the non-initiated listener
yep.
or viewer, what are the sort of key components of mindfulness-based cognitive therapy?
So the first thing it teaches people is to become more aware of what's happening in their body and mind, to be able to see emotions, to be able to see thoughts more clearly, and to see that how what happens for many, many people with recurrent depression, which is back to sort of Tim Beck's sort of incredible observation, which the three people who developed MBCT also had, which is Mark Williams, Idle Siegel, and John Teasdale, is that tiny, tiny fragments of negative thinking or a negative emotion can very quickly spiral into depression. And you see this with suicidality, of course, as well. But with depression, that kind of reactivity can be very automatic and come out of nowhere. And for people who've had a lot of episodes, it's not, people think, well, what happened to you? Did you have a loss? Did you have a bereavement? Now, that often happens with the first episode of depression. But with the third, fourth, fifth, 10th episode, it can come out of nowhere. And I know that personally from my own experience. So what MBCT does is it helps people to become aware and to see that, and then be able to meet it in a different way with a sense of standing back from it, seeing it with a bit of friendliness, and knowing that you have a choice about how you respond in that moment. So out of reactivity, what will typically happen is somebody will wake up at 3:20 in the morning, one of the symptoms of recurrent depression, early morning waking, and bang, they're into rumination. They're into thinking, oh no, here I go again. This is depression setting in again. So that's depression. That's the downward spiral into depression. And what MBCT helps people to do is to see that moment and help them to ask, what do I need to be doing in this moment right now? First is to step back from the reactivity, maybe be a bit kind to myself. Do I need to get out of bed, go downstairs, get a drink? Or can I maybe, for people who are a bit more advanced in their practice, can I get out of my head and maybe do a body scan? What that means is a mindfulness practice from the feet all the way up back to the head. So what you're doing is you're breaking that cycle of reactivity. And for more advanced practitioners, people who've been doing this for a while, by the time they get to their knees or their pelvis or their torso, they're back to sleep. Now that's so different from getting out of bed, being tired the next day, being worried about your job, and that downward spiral. So that's what MBCT is trying to help people to do.
Okay, no, that's really helpful, really helpful. Okay, so back to the evidence then. So 15 trials.
Without a doubt, better than usual care. The mainstay approach that most clinical guidelines would recommend for recurrent depression is maintenance antidepressants. So the next question is, can it do as well as maintenance antidepressants? The answer is yes, it can. So it
was
can...
the prevent trial?
Yeah, there's been a number of trials now. And we also did what's called an individual patient data meta-analysis, which again, for people who are not familiar, you write to all the people who've done the trials in this area. And we have your raw data. So we looked at the raw data and we were able to show very clearly that mindfulness-based cognitive therapy can provide people with an alternative to come off their meds. And that's important because I'm not anti-meds at all. Meds are great. I've used antidepressants myself, but they have side effects and they can blunt people's feelings. They affect people's sexuality. People can have reduced libido and other changes in their sexuality. And so being able to give people a choice is phenomenally important. And then there's a trial just published this week, actually yesterday, in Lancet Psychiatry, which I think is an incredibly exciting and important trial. It's led by Thorsten Barnhofer. And what they were able to do was to say, okay, the most people with depression who are accessing psychological treatments are getting these high intensity treatments, typically CBT. Glass half full, 50% of them do well. Glass half empty, 50% of people in so-called improving access to psychological therapy services in England do not respond. This trial targeted those people, and it was a randomized controlled trial and able to demonstrate that you can get those non-responders well and that it's highly cost effective. I mean, that's huge. That's a really, really nice bit, again, of translational science.
Yeah, no, I read the paper yesterday actually and posted about it on social media. It's a great study.
It's a nice study. Really, just a really, I mean, I love the one thing we're both scientists, right? I just choose a really good question and do the very best science you can to answer that question. That's when science gets really
Mhm.
fun. So,
Yeah,
you've got great treatments, but only 50% of people respond. What we offered the other 50%? Oh, how about this? Gosh, it works. Is it cost effective? Hell yes.
yeah, yeah.
That's
No,
great science. I mean,
yeah,
that's great science. So
fantastic.
now again, for your uninitiated to science kind of listeners, you have the final stage of the translational pathway, which is the implementation gap. There's no point having a paper in Lancet Psychiatry. What you want is that your family members and friends, my
Yeah,
family friends, and can go to their GP or go to their local mental health service and say, I've read about this. I want to access this. So you have to get these things into services. You have to get them into places that people can access them. And that's actually quite tricky. It's quite hard. And we have done a huge amount of work to make MBCT accessible within healthcare services, both here in this country, but also internationally. But it's really hard. And
hmm
limited resources, the mindset primarily in mental health is rightly dealing with crises and treatment. There isn't enough headspace and financial resources to turn towards prevention, let alone long-term mental health promotion. And I
yeah.
think there's a reality to that in terms of limited resources and just where people's focus are. I mean, if you, in thinking, Rory, about your work, if you've got, particularly with young people who are suicidal, everybody, of course, wants to prioritize that rightly. But we do also need to be thinking about prevention and mental health promotion.
Well, absolutely. But remember, as we both all, well, many people will know that even with the acute suicidal people, they still have a waiting list, sadly, for treatment too often,
Of
far too
course.
often. But actually, on the preventative stuff, we'll come back to the preventative stuff because I think what you've got in your book, Mindfulness for Life, is a great model of trying to reach the
Yep.
masses. But
Yep.
let's come back to that shortly. Okay, a couple of questions still on the evidence end. So with Thorson's trial, we can get in terms of sort of sensitivity or specific populations that identifies a really important
Yep.
population who works for. But what other populations are there particular populations in the broader adult evidence base that mindfulness seems to work for better than others, and who maybe is not as effective for?
So I would say the strongest evidence base is around depression. And I'd say the second strongest evidence base is around people with chronic physical health problems who are struggling with their mental health, be
Okay.
that chronic pain, be that cancer, be that a range of other chronic conditions. These conditions are hard to live with, right? So people
Yeah.
suffer from anxiety, they suffer from existential questions, loss of hope, um, changes to their functional status, their relationships, and there is a really strong evidence base that mindfulness-based approaches can help that group
Good.
of people. I think the evidence base for other mental health problems, I would say, is in many cases promising, but very early stages.
Yeah.
Actually, there is one exception to that. There's a group of people in the States, particularly, who have looked at addiction, and they have developed a particular program which is using a mindfulness-based approach to help people with addiction. And again, similarly to the Barnhofer Lancet Psychiatry trial, this has been published in some of the very best journals in the States.
hmm
Because of course, in the States, you have the opioid crisis.
Yeah.
This is
Yeah.
not really non-trivial, right? This is like massive problems with suicidality, with criminality, and the very nature of these opioids is they're very, very difficult to come off. And so what they've been able to demonstrate is that these mindfulness-based programs can help people to come off their opioids and function and get back
Wow.
into recovery. And I'm happy to send you and Craig the notes for if you want to put them in the notes afterwards. But
Yeah.
these have been published in some of the top American journals recently as well. So I think and if you step back for a moment, it kind of makes sense, right? Because we can medicalize problems, like particularly opioid problems and chronic pain. But fundamentally, there is no doubt that there's a whole sort of psychological landscape in the background. That if we
Yeah.
pay attention to that, it's likely to be a sort of interaction of the psychological and the medical that are going to be part of long-term recovery.
Yeah, yeah. No, I mean that's really, really encouraging about the opioid applicability because obviously that's just era defining, sadly, in America at the minute, as we know, and beyond. Okay, so moving on then. So that's adults. You obviously led what's called the Myriad trial and the massive school-based trial. So do you want to tell us about that? Because obviously that was, I mean, I imagine that was one heck of an endeavor. I know it's a huge collaboration, and what many people may have known about it is it didn't work, right? So, well, not that it didn't work, that in terms of efficacy or effectiveness, mindfulness did not wasn't better than treatment as usual. So do you want to tell us a bit about, well, first of all, your experience of, I mean, putting that trial together? I know lots of others were involved in it, and yeah, and then how you've managed to, yeah, because the day when the data were unblinded and you discovered the outcomes, and I know you've done a lot now to unpackage it in publications, but do you want to tell us a bit about that?
So I'm a scientist, and I am not for a minute going to minimize what you've just said, which is you're right that the trial did not support the hypothesis that this
Yeah.
was effective. But what I am going to pull you up on is it didn't work.
Well, no, that's why I changed my wording halfway through. Yeah, because I
Yeah. So
agree.
what I
Yeah,
what I would say
yeah,
is I felt immensely privileged to be in Oxford in the early days of the pandemic, and the lights of the labs were on 24 hours a day as people were developing the AstraZeneca Oxford
yeah,
vaccine. And if in the early days you had said to them, you should give up, guys, that last Petriclib experiment, that early phase trial didn't work. That's not how science progresses. The way science progresses is as we said before, right? We ask good questions and we answer them as best we can, and then we see what we can learn from it. So I think you and I are on the same page, but I think yes, it didn't work. So but we went into this trial that it was led by myself, Mark Williams, Sarah Jane Blaymore, Tim Dalglish, 100 other researchers, 28,000 children, more than 100 schools, 700 teachers. It was huge.
yeah.
We're
No,
very, very
amazing trial.
fortunate
Yeah,
to be funded by the Wellcome Trust and well funded so that we could answer the questions. And of course, the rationale for it, as all the scientists listening to this will know, securing research funding is not easy. People don't give research funding without you writing a really good proposal and actually making sure that all the building blocks are in place. So the question was a very simple one, which was to say, okay, we've worked with adults. We've shown that mindfulness-based cognitive therapy can prevent depression in people at high risk. But when does depression first arise? Well, it tends to first arise in mid to late adolescence or early adulthood. 50 to 75% of depression will arise for the first time in that developmental window. So can we teach people these skills to prevent depression before it first arises? It's kind of a no-brainer. It makes sense, right? Go upstream and try and prevent these problems from happening. And can we at the same time try and think about where that group of young people spend most of their waking hours? Okay, it's in schools. There seems to be a real interest in schools as being a vehicle for promoting social and emotional learning and mental health. And can we make sure that it's potentially scalable? So can we make the school, the teachers within the school, the vehicle for delivery?
mhm.
Tick, 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 lots of really kind of sensible ideas, lots of proof of concept, lots of systematic reviews, feasibility studies, and off we go with the trial. And the centerpiece of the trial is a cluster randomized controlled trial, which basically means the unit of randomization is the school, not the individual kids. The whole school is randomized to the intervention, and the other school that's not randomized to it has teaching as usual. So we had 84 schools, half of whom were teaching mindfulness to their kids, and we had a nice long follow-up of a year. And we've actually just completed a 2-year follow-up. And when we came to look at the results of does this mindfulness training for kids in schools delivered by teachers improve their mental health, reduce their risk for depression, and have a whole range of other outcomes. All of us as scientists were sitting around. We had this amazing statistician, extraordinary statistician. It's one of the things I love about science is you kind of put a team together where people
Yeah.
have all their requisite skills. And he kind of knew that we would struggle with this. So he said, I'm gonna need an hour to talk to you about this, and I want no interruptions. And basically, as he went through, and we didn't unblind. So we looked at all the results, not knowing which group was which. So on our primary outcomes, which are the ones that you specify in advance that are absolutely key, there was nothing going on, no difference between the groups whatsoever. So of course, at this point, I'm still hoping for the best. And Obi has anticipated this. So he sort of puts up the distributions, he puts up the confidence intervals. He says, there's no guessing, no, forget it, nothing, nada, zip. And then we get to the secondary outcomes. We're still blinded to groups.
Yeah.
I think, okay, well, now we'll see some action. And we look at all of our secondary outcomes, and there's a small subset where group A is better than group B. And I thought, oh, thank God for that. And then at the end, well, the next thing we actually did was we then wrote the introduction to the discussion without knowing which were the two groups.
Oh, okay.
So that
Right.
we could be really kind of like,
Dispassionate, yeah.
yeah,
Yeah.
it's good practice. And and then he broke blind. And the group that was actually doing slightly better was the usual care group.
Yeah.
So the group in the mindfulness condition, just on a small number of outcomes and tiny, tiny effects. So we had
Yeah.
huge power. We had a lot of numbers. So you can find statistical differences where they're
Of
actually
course.
just
Yeah.
tiny. But there was a slight signal that on a couple of these measures that these kids did a little bit worse. And then we spent 2 years trying to unpack what had happened and to learn from it. And this is back to the vaccine thing, right? So that, okay, so that hasn't worked. And what can we learn from this? Well, the first thing we learned, which is really important, is the kids didn't engage with it.
Yeah.
Just because adults think something's a good idea, just because adults have run a program and a subset of kids have come up to them and said that's life changing, the other 99% of kids are going out of the room saying that was really boring and a waste of time and made me feel a little bit worse in some cases. But we weren't listening to that before, whereas in a big RCT like this, we were able to look at the qualitative data and the survey data, and the kids were not engaging with,
Yeah.
really not engaging with the program. And some of the qualitative data suggested that yes, a few of them had some positive things to say, but quite a lot of them had some quite negative things to say as well. I mean, not in a that there was a problem with it as such, but just that it wasn't engaging them. And anybody who's got kids of that age, if you look at Minecraft or Fortnite or some of these programs, they're just beautifully crafted. They're amazing
Yeah.
landscapes. And that's where kids are spending some of their time. So if we're offering them sort of apps and practices and we're competing with some of these other ways of engaging and learning, it's a bit like David versus Goliath, I think.
Yeah.
Um, I think the second thing that we learned was getting a program like this into schools is really hard. Teachers have so many things to do, and teachers themselves are burned out and struggling. And what was really interesting, Rory, is that the teachers and the schools benefited from the program. So the teachers had to go through the program themselves, and they reported reduced burnout, and the school culture seemed to improve.
Yeah.
And then the final thing we learned, which I think maybe will take us on to the next part of our conversation, which is we were able to do some quite cool prospective work predicting what was associated with young people's mental health and what predicted which kids did well through the COVID pandemic. And it was nothing to do with their intrapsychic landscape. It was to do with the climate of their home.
Yeah.
Did they feel safe at home? Did they have a parent they could talk to? Was there a sense of fun at home? It was to do with the climate of their school. So some of these kids were moving between school and home. And if the school was a place that actually felt safe, someone to talk to, good anti-bullying campaign, those kids do well. And then what is this age group? Well, it's teenagers. What's most important to teenagers? Their peers.
Yeah.
So if they've got a strong peer network, this is really important to mental health. And I guess that's the final bit of learning, I would say, is I think we as psychologists or all people interested in mental health, we need to move our lens out amongst young people from
Yeah.
the individual to the sort of meso, the exo, and the macro
Yeah.
factors that are around those young people. And you emailed me in advance a question. You said, what is the most important question you think you'd like to see answered in this sort of mental health space?
Yeah.
I would say it's how can we target that level? How can we bring the very best psychological science to bear to help us understand what does a school, a workplace, a prison look like that supports the well-being and the mental health of the
Yeah.
people who study and work or incarcerated within it?
No, because I think that, I mean, I couldn't agree more with that. And I think actually as psychologists, I think too often we've been so focused on the person,
Mhm.
and when we talk about having a biopsychosocial approach, but we don't do enough about really looking at that interplay between the person and
Yes.
their context.
Yes.
And even though we say it, it is a difficult thing to try to understand, but I think absolutely, I think that's a great suggestion. But so then, I mean, because what I've been most impressed about, I was really impressed, obviously, reading the incredibly well designed study. But what you've done after it in terms of trying to look at what you have learned from the trial is immense as well, and hopefully
Mhm.
will set the foundations for the next steps. So, what are the next steps? Are you thinking about trying to tailor mindfulness to the digital world, or what have you any thoughts in that regard in terms of like delivery in that context, or is that possible?
Am I allowed to ask you a question?
Yes, of course you can. I may not answer it, obviously, because it's
So
my
if you think about, because of your expertise, if you think about suicidal behavior amongst young people, to what extent is interventions at the level of the family, the level of schools, a promising way forwards, as opposed to thinking about interventions at the level of the individual? I mean, is that something that kind of resonates for you as well?
Yeah, no, totally. It's that interface. But so if you look at schools, for the evidence base for schools and suicidality, there's a peer-based intervention. Dan Nuder who led this trial a few years ago, European trial in schools from Sweden, and that a peer-based intervention working with schools on mental health.
Very interesting.
So that was effective.
Yeah.
But a lot of the others weren't, or none
Mhm.
of the others were. There's in the States, there's a couple of programs in the States where offer promise, but I think what they all the sort of common theme in more if I look more broadly, not just at schools but in other settings, it's trying to understand that connectedness between an individual and you mentioned of your peers.
So
And
if you had unlimited funding, research funding and implementation funding, where would you put your energy at that interface?
that's a good question. Well, I would do two things. One is if we look at mental health more generally across the lifespan, one is the
Mm.
single biggest predictor of poor mental health is structural inequalities. So if we tackle structure, so we'd have to tackle
Yep.
structural inequalities, right, first and foremost.
Yep.
But then, crucially, coming back to my point earlier about the person and context, we
Yes.
know there's lots of people in adverse circumstances that they do thrive. So
Yep.
for me, that individual bit is trying to understand
Yep.
that interplay.
Yep.
How do we protect people, and then how can we harness that for those who are most vulnerable? But
Yep.
anyway, back to me, back away from me, back to you, back to you, right? So, but have you, in terms of the digital stuff, have you thought about trying to do that? And I mean, I just don't know if mindfulness is amenable to that. Because I know there's lots of apps out there, right?
I'm not that interested in going down that road.
Yeah,
I
yeah.
don't think it's the answer. And partly
So
because
what do
I've
you think the answer then is?
I think it's two things. I think it's taking the evidence-based approaches that we know work and making them accessible to people.
Yeah, 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 yeah.
So I love Jeffrey Rose's work, which is a sort of population approach. So for those people who aren't familiar, Jeffrey Rose is a public health scientist, and his proof of concept stuff was around heart health, and he basically was doing this work, say 50 years ago, where the focus in heart health was on people who'd had a heart attack and treating them,
Mhm.
and then maybe thinking about people who had hypertension and treating them. So, in terms of heart health, that is, if you think about the population of people and heart health, most people have got relatively healthy hearts. Some people have got very sick and unwell hearts. Some people have got hypertension, they're at risk, and some people have got super amazing heart health because they're athletes and they eat well and all these kinds of things. And so, Jeffrey Rose's argument was if we're serious about heart health, we need to think about the whole population. So if
Mhm.
somebody's had a heart attack, yes, we need to understand what it was. We need to put a stent in, or we need to do a bypass, whatever it is. We need to treat those people. Same with mental health. If people have got frank psychosis, they've highly suicidal, we need to offer them treatments, keep them safe, get them well. That's at the kind of unwell end of the spectrum. But if we are serious about mental health, we need to think about what drives mental health and the people who are languishing, the people who are well, and the people who are flourishing. And we know a
Yeah,
lot from psychology about what supports that. And what we need to do is put those things in place.
yeah,
Those things are about supporting people with well, some aspects of mindfulness, awareness, emotion regulation, good friendships. And some of this stuff is really not rocket science. In the same way, heart health isn't rocket
yeah.
science. Decent friendships, decent food, decent sleep, sense of purpose and meaning. And I can flip this off and it sounds trivial, but we're not thinking about those things for many people in the population. As you said, if people are living in abject poverty with inequality, they are not having access to good food. They are maybe sharing a room with three siblings, so they're not sleeping well. And so these sort of basic building blocks of mental health and well-being are not being put in place.
Well,
So
it's
I
just
think
basic.
that
It's homeostatic function, isn't it? It's really tackling up on those fundamental processes. If we can tackle those, and then what obviously is interrupting those or deteriorating them or making them overactive, and then they obviously break down.
and And what some people listening to this might say, well, look, we've heard all this stuff and this is kind of, but we're not putting it into practice.
Yeah,
If you
I
take the
agree.
analogy of heart health, 50 years ago, probably you would have been smoking a cigarette right now. I would have been smoking a cigarette right now. We both probably would have been more at our age overweight.
Yeah.
Exercise wouldn't be part of our lifestyle, but that's not the case. You're not smoking. I'm not smoking. Neither of us are morbidly obese. And that is good for our longevity and our health.
Yeah.
And I think we need the same thing with mental health. So, in the sort of wellness and the flourishing range, we have started to demonstrate with some RCTs that teaching people skills in mindfulness, teaching skills in being able to decenter, teaching people skills in being able to have activities that promote mastery and pleasure, they support people in thriving. And we just had a study from our group, one of my PhD students and postdoc, Shannon Maloney, in which we actually recruited people. I mean, in a way, it's almost the opposite of the Thorsten Barnhofer trial. It was a trial in which people had been through a mindfulness program but wanted to extend their learning, and they were well. So on that sort of Jeffrey Rose model, their
Yeah.
well-being scores were well. And they went through this program, they learned these skills, and we took them into the flourishing range.
Okay. Yeah.
Now, that's really interesting, right? And you say, well, shouldn't we be putting our resources on people who are really unwell? No, we should be putting people who are, because those people are parents and they are teachers and they are healthcare workers and they are employees and bosses. And if they are flourishing, they are going to be in a better position to actually support the people around them, which is back to your earlier point about thinking about not just the individual, but the structures and the systems around people as
Yeah.
well. So I would love to see what we've seen with Jeffrey Rose's work around heart health being brought into mental health. And that's where I'd like to spend, the next 25 years of my career focusing. Yeah.
Well, that's a nice segue, I think, to the book.
Yep.
Because in a way, I think that's what the book's trying. Well, my reading of the book is that's in part what you're trying to do. So,
Yep.
mindfulness for life. I must say, I really enjoyed reading it, and it's one I've been dipping in and out of as well. I suppose my sort of disclosure is I've on and off tried mindfulness over
Hmm.
the years, and sometimes I find it easy to do, but oftentimes when I really need to do it, I struggle, and I've tried to practice. And in the past, I've had conversations with many years ago in Oxford, talking to Mark Williams about this, about how to try and get better at mindfulness and where, and that's why I sort of think about it. But what I love about this is because it's really practical, right? So it gives me,
Yep.
and like it's organized across the 12 pillars or 12
Yep.
chapters. But well, like you've got, what's it, who you call the professor? What's it called? You've got your
Barefoot Professor and the Ancient Oak.
yeah, I love those just wee tips. I just sometimes they're
Mhm.
great wee tips as well as obviously you've got the exercises you can do and you can link it into the website and so on. But I haven't gone near the website. I've just looked at the bits on the book, and but so for me, I think it's helped me. I suppose my message to you, I suppose, is it's really helped me
Yep.
try to practice mindfulness better. So I'm hoping I'm one of your target audience. I know it's for anybody, but maybe can you go into the background too? Because obviously this I assume is like you're a life's work type thing. And it's really, really accessible. It's anybody with an interest in mindfulness or mental health, it's for them. And it's just
Mhm.
say that. I think it's you've done that really difficult task of making it really accessible. And the techniques you've used to do that have been great. And so anyways, that's my sort of compliment bit over, right?
Thank you.
So over to you. What was it? So tell us about the background, how'd you go about writing it, and so on.
So just a quick sidebar, and then I just want to ask you to elaborate on something you just said. I do think as psychologists, we have a responsibility to communicate our work
Yeah.
to the people who might benefit from it. And I don't think we're teaching that in undergraduate psychology programs. I think we're teaching people about cognitive psychology and social psychology, but we're not teaching people how can you, let's say you're not going to become a psychologist, which is true of 90% of
Yeah.
undergraduate psychologists, if not more. I have no idea what the actual statistic is. So if you're going to go and work for McKinsey or you're going to go and work wherever you're going to work, even as a barista, whatever you're going to do, how can you bring these ideas into
Mhm.
your life and how can you use them? And I think we're not doing that well enough. So I do think as a sidebar, that's really important. Rory, you said that you feel like you think it's a good idea, but you don't bring it into your life, and then you feel like you fail. Just can you, if you don't mind me asking, what is an area of your life where you feel it doesn't come into play, where you think it might usefully come into play? Can you give me an
Well,
example of that?
if I'm struggling or having a really stressful time,
Yeah.
and I really can't decenter,
Yeah.
I'll try and do some mindfulness. I'll do some
Yeah.
body scanning and try and do some mindfulness. And what often happens is my mind, and I know the answer, right? My mind keeps wandering away back to the problem,
Yep.
keep bringing it back, and then I just give up, right?
Yep.
So, and
So,
the self-kindness bit is I've taken a lot of the self-kindness bit and your idea of the befriending our minds.
yep.
That's really I found that really helpful, right?
Yep.
So that's my example.
So I'm going to give a really concise response to your question, and maybe a slightly longer one. I think what you've described is one of the real main reasons why I wrote this book. The number of people who say what you've just said, which is, I get this, I've tried this, it seems so useful, and then I can't do it, or
Yeah,
I've given up doing it. I'm so sorry I've given up doing it. So the sort of the really fundamental shift I've made in the book is it's not like you're learning these practices to then apply in your life. Your life is your practice.
yeah, and I think you do say that
And
sometimes.
your
Yeah,
life is your practice.
yeah, yeah,
So that moment where you're feeling overwhelmed and you're feeling stressed, and you have this thought, all right, this is the time I should be doing a body scan. Forget the body scan. That moment is your practice. And if you can meet that moment with a little bit of awareness and a bit of friendliness, that's mindfulness right there.
mhm,
Whoa.
mhm.
Because what would the friendly voice say? If your best mate, Rory, was next to you, you're absolute, they got your
Yeah.
back, they love you, they're always there, they're your best. What would they say to you in that moment?
No, I know what they'd say. They'd
What
say,
what would they say?
well, they'd say, be kind to yourself. It's, it's not as big a deal as you think it is. There's lots of things you would try and provide some support or at least some validation, right?
But that voice, we switch that voice off, right? And that's my point. We switch that voice off, or actually, for many people, because you're a psychologist, that voice is even. I think many people, it's like saying to a fish, what are you swimming around in? They go, what do you mean I'm swimming around in? I'm not swimming around. What are you talking about? I think that for many people, they're there.
Yeah,
Of course,
yeah,
you're there, so you can say, "Oh, I'm swimming around in this water of high
yeah.
pressure," and excuse me for saying, but you're a professor. You're leading a program of work. Of course, you're going to be busy. Of course, you're going to be full on. Of course, you're going to be stressed. You wouldn't be who you are. You wouldn't have
Yeah.
done what if you weren't. I mean, get real. Do some other job if you weren't going to experience this.
I thought you were going to be the kind
But this is
friend.
what I mean. It's like the life is the practice. It's not
Okay.
about being mushy and kindness can have a real kind of edge of courageousness and lion-heartedness, and it can have a real edge of wisdom and discernment
Yeah,
to it. And I think that's the biggest shift is to make your life your practice. And as later in the book, in the later chapters, you put in place the building blocks for people to be able to, in those moments, just take a moment, just come into the body and mind and say, what does this moment need? That's a
yeah.
really, really simple question. What does this moment need? Now you can make that more complicated, not more complicated. You can elaborate that question. Say, what
Mhm,
do I need in this moment? But you could also ask, what's needed by the people around me in this moment?
mhm, mhm.
What's needed by the wider community? So I remember, similar to you, a school teacher telling me that it was parent-child conference time, and she's got 5-10 minute slots, and she sees a boy come up to her who is quite problematic, and he has been called up for bullying behavior. She sees him coming towards her, and she has a sinking feeling, and then she looks up, and there's his dad. His dad's this huge brute of a man. And she has another sinking feeling. And then she sees that the boy looks completely different next to his dad. He looks very cowed and he looks very well. And then she has a sort of little flash of insight. She goes, "Oh, that's interesting." And then she puts her from the time that they're going to walk from the
Mhm.
chairs to her, all of this is going on. She's like, "Okay, I'm going to put my feet on the ground. I have a sense of sitting with a sense of
Yeah, yeah, yeah.
uprightness." And she goes, "I've got a bit of compassion for this boy because if that guy was my dad, I'd be quite scared some of the time too." And that was just in, so she made her life her practice. And she talked about being able to engage with the boy and the father differently in that moment.
Mhm.
But she also said that from that moment on, she saw that boy differently. And the number of teachers I've heard say to me over the last years that I've been working in schools is every child with a behavior problem is trying to tell you something.
Yeah, yeah,
And your
yeah,
job is to try and understand what it is they're trying to tell you.
yeah,
But
yeah,
what we're doing is saying, nope, exclusion, out.
yeah.
Headmaster, get you out of the school. So this is the idea of a mindful school. Can we create the space for children to say what it is that they need
Mhm.
without the need to bully or to hit or to act
Yeah,
out?
yeah, no,
And
absolutely.
I think that's an example of what I'm trying to do with the book and what you're trying to do as well, which is to make our life our practice.
Mhm. And no, I totally agree with that. So in terms, so talk us through the how you structured the book, because obviously you've got these four composites characters, effectively people.
Yep.
So maybe just tell for those, so those of you who haven't read the book or thinking about it, tell the average reader or somebody, the potential reader, why this book's for them.
It's basically a set of ideas that people can just pick up and use in their life today if they want to. But if somebody wants to go deeper, the way it's structured quite intentionally is as 12 stepping stones.
Yeah.
And with each stepping stone, you don't have to like read it from the beginning to the end. You can go, okay, I'll just read it. I'll just sample stepping stone one, and then stepping stone two builds on that, and all the way through 12 stepping stones. And then the idea is that you can revisit them over and over and over again. I mean, I have a book on my bedside table, which is a book very few people have ever heard of, but it's Tolstoy's Calendar of Wisdom, and he spent the last 20 or so years of his life writing it. It's basically a compendium of things that he loves, organized into 365 days.
Mhm.
And every day is a contemplation drawn from poetry, from literature, from the contemplative traditions on a theme. So each of the 12 stepping stones is those themes. There are practices, there are exercises, and then there are these four characters that you see them evolving throughout the 12 chapters. So you can see somebody else's journey. And one of them
Yeah,
is a
yeah,
young man who is nurse working in intensive care, and he's a gay man. And he's talking about his dating life, and he's beginning to use he has some psoriasis, and he's using these ideas in his life. And then we have Mohammed, who's a man in his 30s, who has a serious chronic back pain, and to the point that his wife goes to work and he takes care of the toddlers. And then we've got Ling, who's a single parent in her 40s. And then we've got Sophia, who's a retired older woman, and through the story receives a Parkinson's diagnosis. And it's about how she copes with being a grandmother
yeah.
and Parkinson's and looking after her grandson, Noah. So these characters are in the purpose of bringing this book to life, if you like.
Oh, it does. They really do. And I think even though, because initially when I was reading the start and you obviously described the sort of demographics of the four
Yeah.
characters, I was just wondering how much, as I went through the book, I would try and focus in the one who was closest to my age or whatever it might be. But actually, what works quite well is even though
Yeah.
Ling's nothing like me, I can still take
Yep.
stuff from because yeah, she's a single parent, it's not right, a sole parent,
Yep.
and but yeah, so you can say, oh, there's a bit there, but yeah, so that's, I think
Well,
that's a real
I'm a
successful
I'm
book.
I'm a psychologist, and
No, I know you are, and obviously you thought that.
but no, that's not what I was going to say. What I was going to say, I would love to be a novelist. I read a lot of fiction, and
Yeah.
I love really good fiction writers. But these characters really came to life for me over the 6 years I was writing this book, and I'm lucky to have a lot of good friends and family, and when they read it, they go, "Oh,
Is
that
that
little
me? Is that me?
that moment was me." And I think the reason it rings as true is there's
Yeah,
some of the little examples are quite odd little examples. People go, "How did he think of that?" I didn't think of anything. I just like was a magpie. I just took things from people's lives. And I
yeah.
think that's why it rings true, even when you read an example that seems a bit odd. So, Sam is skinny Sam, and he, in sort of gay terminology, he's a twink. And that's a term I got from a friend of mine, so he struggled with his physique because he felt as a boy that he was really unattractive and too skinny.
Mhm.
But as his sexuality emerged, he started to really feel like actually I can have a sense of confidence and embodiment in my body and in my sexuality. And that example came from somebody that I knew. And I think that's why all of the kind of case examples kind of really resonate. I did do something rather brave, I think, which is there are no references in the book.
Yeah, well, no, I was surprised. I
As
was surprised at that actually. Yeah,
well, as a scientist, I thought,
yeah.
oh my God, are people like Rory going to look down their nose at me and go, what is this man doing? He's published in the Lancet and he's writing this book as if this guy has he lost his marbles? But what I tried to do was to write so that everything I said could at some level be defensible as a kind of clinical academic, as a scientist, if you like. The great late Danny Kahneman did something which I only discovered after my book was in print, was when his book Thinking Fast and Slow was about to come out. Of course, that's not referenced either, and it's quite a popular book. Of course, it's a very popular book, and he wrote,
And it's got references, and it's got references.
and it's got references, but the story is even worse than I thought it was. He wrote to 10 or 20 of his friends who he really respected anonymously, sent addressed envelopes saying, I will pay you $1,000 if you provide me with a review of this anonymously. And his idea was that if these people wrote back and said, Danny, don't do it, it's real suicide. He wouldn't have done it. And of course, they wrote back and said, "This is great, Danny. This
Mm.
is this is
That is a
back to
good
the
book.
point we were making earlier, right? I think we have a responsibility, as Danny Kahneman did, to try and make our ideas accessible
Yeah.
so that people can use them." Of course, Danny got a Nobel Prize for his extraordinary work in kind of economics and
Mhm.
thinking fast and slow. And gosh, what a humble man he was. Yeah, so it has no references, but I do feel pretty well everything I say in there is at some level defensible.
Yeah, no, I mean, once I worked out there were no references, I was okay with it because I did initially I thought, oh, it's just introductions, not, and then, but then you just forget about that. I mean, reading it obviously as a psychologist, but no, I think as you say, everything. There's nothing I thought, oh, that sounds a bit. Where did that come from? Yeah, so I think it's a great read. So we're almost at the end of our time together, Well, and so I wanted to have one substantive question, and I want to end then with two sort of unrelated questions we try and end the podcast with. So the first one is there anything about your work or the sort of future of mental health, mindfulness-based research we haven't touched on yet, and you would like to sort of be important for us to hear about?
Only that I just feel really strongly that we need to step up to the mark collectively as those interested in mental health and psychology, because I think so many of the challenges we face in the world today, not just the obvious ones of the rates of anxiety and self-injury amongst young people, but everything, kind of a sense of polarization, a sense of people feeling disalienated, a sense of all of these, we have really good accounts in psychology, we have really good work in psychology. We have a responsibility to step up to the plate, I think, and to bring these into the mainstream and try and make a difference. That's the only thing I would say.
Yeah, no, that's a great, an important aspiration, which needs to become a reality. It needs to, because I think we have a moral duty, I think, to intervene in the unhappy world and with the
Yeah.
awfulness we're hearing day in, day out globally. Okay, so then two unrelated things then, which we try and end with, as I say, two questions which are independent of the topic we're focused on.
Mhm.
So the first one is, so you were mentioning you've hoping you've got another 25 years of your professional life moving forward. Let's look back and what advice would you give your 16-year-old self?
I'm going to push back on this question and I'm going to say my 16-year-old self was all over the place. I was smoking, I was drinking too much, I wasn't studying very hard, and I'm going to look back and be compassionate on him and say
Yeah.
he was doing exactly what he needed to be doing.
Mhm.
And I hope I can say this with humility. I'm now a professor at Oxford, so I can't be doing too badly. So I'm
Yeah.
going to look back at that
Mhm.
16-year-old self and say, you're okay, mate. You carry on doing what you're doing, and you just find your own way. Of course, there are mistakes I wish I hadn't made, but I just think it would be a real act of betrayal and lack of compassion for my 16-year-old self to say to him, you should be doing things differently.
So I don't think that's a pushback at all. I think that's a good reflection, which is highlights the importance of us being self-compassionate and
I think he was doing the best he can. And I
yeah,
don't know if you experience this too when you work. I just think from our perspective, we really underestimate people of that age group. And I think the
totally.
most important thing to do is really, really try and understand what they're trying to tell us and what we can learn from
Yeah.
them.
Yeah,
And
yeah.
I think that's kind of a sense of kind of honoring and being compassionate,
Mhm.
including for all of the mistakes he was making.
Yeah, I like that idea of honoring our younger selves. I think it's a really important message. Okay, the last, very last question, then I'll let you go, is tell us something about yourself that most people don't know about you. It's more difficult than you think, isn't it?
I'm a qualified sailing instructor. So
Ah,
if
okay.
everything goes wrong, I could always turn to being a sailing instructor.
Well, on that note, I am reassured. The world is a safer place now that I know that. Dear, on this serious note, Willem, thank you so much for taking the time to join us today. The book is fantastic. Those of you who haven't got it, please, I really encourage you to go and get it. Mindfulness for Life, available at all good bookstores and online, and continue on with the incredible work that you and your team are doing. So thank you so much.
Thank you, Rory, and also Craig for all the background support. It's been absolutely stimulating, and I get the sense we could have talked for another 6 hours.
Yeah, we could have. And on that note, thanks a million. Take care.
Cheers.